Good morning. It's a real pleasure to be here and to be part of this important program in integrating care in the hemisphere in breast cancer. I've been here, as you heard, just for a few months, but I'm already very, very impressed by what I see here and very excited about the commitment of the university, the medical school, its different components to the notion of integrated hemispheric health. And I wanted to talk a little bit about that today as an introduction to the symposium. So I thought I would start with a quote by Abraham Lincoln. And actually, if you read it, it could even refer to the hurricane today as well. But it states, "The dogmas of the quiet past are inadequate to the stormy present. The occasion is piled high with difficulty, and we must arise to the occasion. As our case is new, so must we think anew and act anew. We must disenthrall ourselves, and then we shall save our country." And I think as we think about cancer care, we think about expanding our ability to care for women throughout the hemisphere, we have tremendous challenges that will require a completely different approach to the organization of care. And I'll try to give you a little bit of perspective on that. This next slide shows you the incidence and mortality of cancer in Florida. Cancer is the fastest growing diagnosis in Florida. Florida, as you probably know, will have the most significant population growth of any region of the United States over the next 7 to 10 years, approximately 25%. The population will age significantly. Currently, 13% of the population is over age 65. That will approach 30% over the next 10 years. Those statistics are good for healthcare, probably good for real estate, not so good for traffic. And I think that's something that we're already experiencing here. So how do we think about an approach to cancer care in the future? And I think we have to think about the notion of quality healthcare. And how do we design a quality healthcare system? And this really involves everything that we do in healthcare. Cancer is certainly an important component. We have to think about the notion of quality when we think about diagnosis and treatment of cancer. And value is defined as quality, and quality can be defined as many, many ways. Outcomes, safety, access, there can be multiple variables that one would look at divided by the cost. So the notion is we have to provide quality care for the right cost. Certainly in the United States, healthcare is approaching 30% of the total economic output. It's currently above $2 trillion and will rapidly approach $3 trillion. So very, very significant. What's remarkable, the trends that we see in the United States are being seen throughout the world, including the developing world and much of Latin America. The rate of increase in costs in healthcare is really staggering and really is the challenge that we have to deal with in the future. Now, you see a picture here. This is a picture that people will recognize best by age. So the first question is, who is the actor that is portrayed in this picture? Does anybody know? Burt Lancaster, okay. Who is the woman actress? Very famous, Claudia Cardinal. And this is a scene from the movie The Leopard, which is also a very famous novel about the creation of the modern state of Italy from a series of city-states. It won the Cannes Film Festival in 1963. And the most famous quote is, Burt Lancaster plays a Sicilian prince who sees his world collapsing as Italy is coming into the modern age. And his nephew says to him, everything must change so everything can stay the same. And that's really where we are today in thinking about healthcare and thinking about the way that we have to approach care in cancer. Everything does have to change if we can meet the needs of an ever-growing society, more complexity. It is going to be the development of this value-based healthcare system that is really critical moving forward. Now, there's been a tremendous amount of work done in what constitutes a value-based healthcare system. I've given you one paradigm here that is from Professor Michael Porter, who is a university professor at Harvard Business School. Professor Porter is one of the foremost experts in the world in corporate strategy and in competition. And what is remarkable is that he's devoted probably the last 20 years of his career to reforming the healthcare system. I think it's a recognition of how important he sees that to overall economic growth and the business. And there's 6 components to Professor Porter's paradigm: the organization of care and integrated practice units, measuring outcomes and cost, very important, but the most difficult thing that we do in healthcare is having reliable methodology to measure cost and outcome. He talks about a reimbursement system that is focused around an episode of care, integrating care across many facilities, expand areas of excellence across geography, and we'll talk a lot about that in the context of a hemispheric approach to cancer care, and then build an enabling information technology platform. And that really becomes the basis of data collection that we need in the future. If you look at the organization of Sylvester today, we have the main cancer center within the health district, and then have the association with primary care doctors, with specialty care, with other hospitals throughout our region. There's also a component of home care that we do in cancer care right now that's actually becoming more and more important. The notion now is for this regional network that serves South Florida to develop the relationships throughout the hemisphere. And those will be on multiple different levels. I think primarily, and where we are today, Sylvester serves as a referral center for the most complex patients located throughout the hemisphere. But there are other ways. There's exporting of care pathways. There's exporting of knowledge. There's the development of clinical trials and other research projects that are all part of the way that we have to interact within the hemisphere. Now, one of the most important principles of value-based care is the notion that you organize the care around the patient, not around the provider. And what that means is that if you have breast cancer as an example of a diagnosis, when you come to the facility where you're going to receive health care, you should be seeing the medical oncologist, you should be seeing the breast surgeon, you should be seeing the plastic surgeon, you should be seeing the social worker, you should be seeing the individual who's involved in organizing clinical trials. That all has to be integrated in the form of one-stop shopping. That is the methodology, that is the care model that provides the best results at the most appropriate cost. Now, this is a graph that shows cancer survival rates in the United States. And you can see a number of lines there, and I hope it's large enough for you to see. Oh, didn't. There you go. These are a number of different hospital types where you can receive cancer care. Now, in the United States, there is a group of hospitals that are known as prospective payment exempt institutions. This is a special designation from the federal government, and it refers to 11 specialty cancer hospitals in the country. And these are some of the most well-known names in cancer care worldwide. Names such as MD Anderson, Memorial Sloan Kettering, Fred Hutchinson, Sylvester Comprehensive Cancer Center is one of these. And what you see here is, because of this focus around cancer, they have the best survival rates of any place where you can receive cancer care in the United States. And this goes back to the notion of really specializing and integrating care and being laser focused on what you're trying to accomplish. Additionally, if you look at the cost, and again, as we talked about this notion of a value-based system, excuse me, cost is also extremely important. If you again compare the different places where you can receive care, the cost at the PPS-exempt hospitals over an episode of care is thousands of dollars less even than the best-known academic medical centers. So again, outcomes, cost, think about that in the context of value. Now, remarkably, this is a report, an audit by the Government Accounting Office, and what you see is, and I think this is something that we can utilize, is even among the PPS-exempt institutions, you can see Sylvester's is one of the lowest costs of any PPS-exempt hospital. So if you compare us to the City of Hope in LA, you can see the difference in cost for a Medicare patient. So this is something that we have the ability to develop very high quality, to deliver high quality, appropriate cost care throughout the hemisphere. The other part that I think is critically important, and this again relates to the notion that we as a comprehensive cancer center located within the Miami region can act as a referral center and be supportive of integrated cancer care throughout the institution. And this is a graph that shows you that a lot of the patient growth in Sylvester is actually the referral and transfer of the most complex patients in the region and in the hemisphere. That has been the greatest growth, and that's where we are concentrating our efforts in. That is our proposition, or our value proposition within this healthcare system, and the notion of regional and now hemispheric cancer care. So I leave you with one final quote. A forward-looking CEO must do three things: manage the present, selectively forget the past. That's the most difficult thing to do, quite honestly. And the most fun thing to do is create the future. Thank you very much, and have a wonderful time here.